The palliative care sector in New Zealand is facing growing challenges, especially around funding and the prioritisation of services. Recent government proposals to cut two crucial roles in the department of a national palliative care strategy has raised alarms. And this comes at a time when patients are increasingly transferred from aged care facilities or hospices after requesting assisted dying, putting a strain on the sector. The issue of funding and resource allocation has sparked debate, especially as the demand for palliative care rises. Despite an ageing population and advancements in medical treatments that prolong life, palliative care services are struggling to meet demand. Critics argue that while assisted dying services receive adequate government support, the same level of attention cannot be said to palliative care. And this discrepancy has become a focal point in the ongoing discussion about end-of-life care and the availability of resources for terminally ill patients. The government's decision to reallocate funds for assisted dying teams has led many to question the balance of priorities in the healthcare system. Wayne Naylor is Chief Executive of Hospice New Zealand, and he joins me now. Wayne, good afternoon.
Kia ora, Leah. How are you?
I'm good, and look, I thank you for your time, Wayne. And I think it's a really important conversation because, we are all going to meet our maker and die eventually. We are an aging population, and whether we choose, we end up in palliative care or take an end of life decision, I think talking about it is really healthy as well, Wayne, because a lot of people don't really want to talk about it, I suppose, or think about it. Can I start with what's your reaction to the government's proposal to cut these key positions that I understand are related to palliative care? How do you think that will impact the sector?
Thanks, Leah. So at the moment, in the entirety of Health New Zealand and the Ministry of Health, our two key health agencies, there's 1.8 full-time equivalent staff, that's two people, working on palliative care. And palliative care is the care of people when cure is no longer possible, and the care is focused on support, managing symptoms, supporting the family, providing emotional and spiritual support. So palliative care is quite broad. It's applicable to many different illnesses. People think it's just cancer, but actually it's also applicable to any sort of end of life, end-stage disease like heart failure, kidney disease, etc. So there's a lot of people who are dying in New Zealand who would benefit from good quality palliative care, probably in the region of 90% of all people who die, where their death is foreseeable. At the moment, hospices see about, I think our latest count's about 19,000 people a year, just nearly 11,000 of those people die. So that's about, not even quite a third of people who die. Yeah. There are many more people who could benefit from palliative care. And these two people in Health New Zealand are tasked with trying to improve palliative care. For last year, that's about 34,000 people across not just hospice, but hospital care, aged residential care, home and community support. They have a very big job for a very small FTE, and they have been doing a really good job in bringing diverse sectors together, developing a work program to improve things for those thousands of people who are dying. And we risk losing them, which means that whole work program, the whole bringing the sector together could end.
Two people, Wayne. I mean, goodness.
When you think about what you said earlier, everyone's going to die, and for some reason our health system keeps denying that that's a fact.
Wayne, you have said hospices have they've got a few challenges, but they have a challenge by the perception that hospice was a place to go to die. Can you explain that?
Sure. So when you think about hospice, most people think of a building, and they think of that's the place people go to die.
Yes.
But actually, the hospice is about a philosophy of care, which is based around palliative care, or palliating a person when their disease is no longer curable. And a lot of what we do is help that person make the most of their life in the time that they have remaining. And almost all of the care from hospice and the support is provided outside of the building. There's, hundreds. Actually, there's about 600, almost 700 nurses. There's dozens of doctors. There's counsellors and spiritual people who are going out into the community every day to visit people at home. That's where the majority of hospice care takes place, in people's homes. There are staff going into rest homes to support residents, but also more likely supporting the staff who are caring for those residents. Some hospices have people going into hospitals, staff to help support the hospital teams. A lot of our hospitals have palliative care teams in them. So, so hospice, it's not a place you go to die. About, I think, 10% of hospice patients die in the hospice. The rest of them are dying in the place that they normally call home. So it's not a place you go to die. It's more around the philosophy of how we provide holistic care to the person where they are.
Yeah. Right. Okay. So the sector is calling for a more balanced approach that respects patients' choices at the end of life. Is it unbalanced at the moment? What do you see it as at the moment?
So I guess the argument there is, and respecting that people have a legal choice for an assisted death if they want it, and that service is primarily coordinated through a Health New Zealand team and a Ministry of Health team. There's two different teams there that make up, I think, around about 10 full-time equivalents, maybe somewhere around that. I don't know for certain. That service is fully funded. So if you want an assisted death, no matter where you are in the country, although I also recognise that is a challenge as well, you should be able to get someone, a doctor who is paid to come and see you. And that can mean that they might travel. That travel is paid, or if they have to stay the night, that gets paid for. It's fully funded. For hospice care, and like I said, so that service, assisted dying, is for around about, last year, I think it was somewhere in the region of 330 people who had an assisted death. There's a number more who had assessment. So it's a fairly small number. It's less than 1% of all deaths. For hospice care, hospices are funded around about 65% of the cost of delivering their clinical services and support services to those 19,000 people and their family. The other 35%, which is around about $60 million last year, hospices had to fundraise through their retail second-hand shops and fundraising events. So, and plus on top of that, they had to pay for the retail and those events, which is about another $40 million on top of their $60 million that goes to clinical services. So it's a really big ask for communities to fund this essential service to help people die safely and supported where they want to be. So it's quite a big discrepancy, 100% funded to 65%, and that's on average. It varies across the country.
Wow. So then having said that, because that is quite phenomenal, those numbers, do you think the role then that the government should be playing is to support both palliative care and assisted dying services? I mean, is there a better way to balance the funding for both?
I definitely think there is a role here for the government to fairly fund the services that it is obliged to provide. I would argue that they are obliged to provide palliative care for all people who are dying, because the majority of people in New Zealand die a natural death, and we want those deaths to be dignified, to be pain and symptom free, to be in the place that they choose. That's very difficult because hospices do what they can within the amount of funding that they get from the government and that they can generate from their community. They don't provide services based on need. They would be seeing a lot more people if that was the case. So yes, I think the government needs to more fairly fund hospices. The way hospices are funding is very different across the country because of our previous DHB model. And this is actually what those two people in Health New Zealand were doing. We're working on reviewing the model of care for children and adults. Children's palliative care in New Zealand is a whole other story, which is quite depressing. So we have a more nationally agreed approach to this. We can better allocate funding based on need to address areas of inequity, and we have it across the system. So all people who care for someone who's dying are involved and can have a say, and we start working better together.